Hepatitis is inflammation of the liver, most commonly caused by viral infections. These include the hepatitis A, B, and C viruses. The hepatitis B virus, or HBV for short, is a member of the Hepatinaviride family. The prevalence of HBV in the United States is relatively low compared to that of global statistics. However, there are still 800,000 to 1.4 million people in the US that have HBV infections every year, and there are 2,000 to 4,000 HBV-related deaths in the US per year. The global prevalence, however, is much higher. There are approximately 350 million people with HBV infections worldwide annually, and 600 to 20,000 deaths worldwide. Its normal hosts include humans, non-human primates, and some birds. Duck HBV, for example, infects a wide range of waterfowl, however, is non-pathogenic in these hosts. This is the virion of the hepatitis B virus. It is surrounded by an envelope which contains surface proteins and antigens. The capsid is icosahedral in shape and approximately 40 to 48 nanometers in diameter. The core contains the virus's genome, which is composed of partially single-stranded DNA and has approximately 3 kilobase pairs. Furthermore, its genome replication involves the use of reverse transcriptase. Transmission of this virus occurs via blood-to-blood contact or contact with other bodily fluids. This contact can occur through sexual intercourse, injection drug use, transplacental contact, contaminated medical equipment, contact with blood or sores, and even contact with toothbrushes and razors. The hepatitis B virus is very hardy and can survive outside the body for up to 7 days. It is 50 to 100 times more infectious than HIV. 50% of hepatitis B infections are asymptomatic, meaning they show no clinical signs of infection. Other symptoms arise as a result of serious liver damage caused by chronic infections. Some symptoms include decreased or loss of appetite, lethargy, jaundice or yellowing of the skin and eyes caused by increased bilirubin, joint muscle and abdominal pain, as well as vomiting and diarrhea. All of these risks can be prevented through getting yourself and your children vaccinated. The HBV vaccine is composed of recombinant HBV antigen components. These components mimic a real infection and elicit immune responses, however, cause no illness. This results in immunological memory through adaptive immunity against HBV-specific proteins, thus providing the patient with the defenses needed to combat an infection. This model represents the adaptive immune defenses acquired post-HBV vaccination, compared to the immune defenses of an unvaccinated individual. The green soldiers represent adaptive immune defenses specific to HBV virus, while the tan soldiers represent nonspecific innate immune defenses. This results in immunity, which prevents the liver from becoming infected with HBV. This side of the model shows the unvaccinated person's immune defenses towards HBV. Since unvaccinated individuals have never been exposed to HBV components, they have no adaptive immunity specific to HBV. This means if they come into contact with HBV in the environment, they are at greater risk of developing an infection within their liver. The vaccine is 95% effective in patients, and immunity can last longer than 20 years. The CDC recommends that all infants and children receive routine hepatitis B vaccinations, as well as individuals who are classified as high risk. These include individuals who are in contact with an infected person, people who have multiple sexual partners, individuals who use injection drugs, healthcare personnel, homosexuals, and people who travel to regions with high HBV prevalence. Since commercial hepatitis B vaccines became available in the United States, as well as the installation of routine hepatitis B vaccination programs, the prevalence of HBV infections in the U.S. has decreased by 82% since 1991. Keep the prevalence on the fall and get your children and yourself vaccinated. Help protect yourself, your family, and others. For more information regarding the hepatitis B vaccine, talk with your family doctor or visit the Centers for Disease Control and Prevention website at www.cdc.gov.